First of all, I'd like to thank everyone for coming this morning, coming from so many different places and so many different positions within your towns as citizens and board members, hospitals, healthcare agencies, social service agencies. To one is here. Thank you very much, and thank you very much to our representatives. We have, starting from the right and going left, Jeanette White, Emily Long, Laura Sibilia, and Kelly Pajala. Just make a few announcements about some things. We have a community event. We support Community Hope and Action, and we're having a Family Fun Day on July 27th at the Townsend Recreation Area. We have our new newsletter, which is hot off the press as of Friday, so please take an issue or issues, as many as you would like, to distribute. I also have an article on the power of prevention. We are a prevention organization doing education and prevention work in the communities. We're based out of Leland and Gray, and we work in the 7 towns in the Wyndham Central Supervisory Union. We also have, for any of you who are interested, we have new signs that now include vape-free, and we love these signs because they do not say this is, you may not, but we thank you for it. So these are hard boards that are weatherproof that you can put on the sides of your buildings. For any that are interested, they are free. And we also have lawn signs that you can put in and take out for events. And we have all of those out front if you're interested in them, or you may contact us and we can distribute them to your town office or business agency. I think that's about it for now. I'm going to hand this over to our representatives, and we'll go from here. And please help yourself to food and drinks.
You're turning it over to us?
I'm turning it over to you.
I don't know what...
You can introduce yourself.
I'm Jeanette White, and I'm in the Senate. I represent Wyndham County. So, why don't you introduce yourselves, and then I guess we'll do something.
So I'm Representative Emily Long. I live in Newfane, and I serve on the House Government Operations. She serves on the Senate Government Operations Committee and is chair of it. I serve on the House General Committee, and I'm also in leadership in the House.
Laura Sibilia. I represent Dover, Wardsboro, Searsburg, Somerset, Reedsboro, Stamford, and a little bit of Whitingham, and I am the vice chair of the Energy and Technology Committee.
Kelly Pajala. I live in Londonderry, and for Wyndham County I represent Londonderry and Jamaica. I also represent Weston, Stratton, and Winhall, and I'm on the House Human Services Committee.
Let me provide a little context to help get us started. So,
Well, and I forgot to say that I chair Senate Government Operations, and I serve on Senate Judiciary in the afternoon, because we're on 2 committees.
So a little context, you all had hopefully either read or had seen my email. So S54 is the current bill that is currently sits in the House Ways and Means Committee. This is a bill that is addressing commercial marijuana in Vermont. And it's a bill that's in process, so it's very much in the making at this time. And West River Valley Thrives called this meeting to help our towns be proactive in thinking through what you may or may not want with commercial marijuana, what fits for your town. And I'm giving you this opportunity to ask questions and talk with our legislators about the current legislation. So, should we open it up for questions? Or?
Well, I'll just give you a little bit of an overview of what the bill is. The Senate has passed a tax and regulate bill, I think 5 times, and passed it on to the House. It's never gone anywhere. This year, the Senate bill did not include any law enforcement, any roadside, or any education or prevention or rehab. And the reason for that is because we felt that it was important to do those in other bills. So we had our Health and Welfare Committee did a huge bill around prevention that took all of the current prevention boards, the tobacco board, the opiate board, all of the different prevention boards, and put them together in one board, so that instead of having prevention for different substances, we now have a big prevention board that's going to deal with everything. So we chose not to deal with that in this bill at all. This was and we also chose not to deal with roadside safety, because we felt that was more appropriately dealt with in a transportation bill. And what this does is simply a tax and regulate. So it's regulation, controlling the quality, making sure that whatever is out there is safe, passes inspection, and taxing it, because it's being used and sold right now, but we're not getting any revenue out of it. So that's all we did in our bill. My understanding is that the House has not done that they've done some roadside, they've done some prevention, so that whatever comes out of the House, it will no doubt go to a conference committee and we'll battle it out there. So that's kind of an overview of what we did. We did not want to deal with any prevention, education, or roadside safety in this bill at all. And all it does is sets up a tax and regulate system. So I don't know if you want to just start asking questions, or if you guys have something to add.
I just want to follow what Jeanette just said, and I'll let these two speak from their perspective in the House. But in the House, as you have just heard, the bill resides in Ways and Means. That's our taxing committee, and it has the only committee that has had possession of it in the House is the House Government Operations Committee. None of us serve on House Government Operations. House Government Operations did reach out to other committees to ask them for feedback on sections of the bill that Jeanette just spoke about. But we have not seen this bill. It has not completed its process through the House, so we don't really have a lot of detail around the bill ourselves. But we welcome feedback from all of you. That is really important.
Yeah, I will add one more thing that's in here, since we represent different towns. There is a provision in here that towns can opt out, which is the same as with alcohol right now. Vermont has always been a state where a town can opt out, and we do have some dry towns in Vermont. You probably don't realize that, but we do have a couple towns where there's no alcohol sold or served at all. I mean, served in your home, you can do it, but. And the same thing would be true here. A town can vote to opt out of allowing any kind of a cannabis establishment in their town at all. There also is provision in the Senate bill for a town that does allow establishments, whether it's a grow facility or a retail facility. Well, this would only apply to a retail facility. A 2% local options tax on the sales. So that's a way of allowing towns to, if they're going to have retail sales, they might feel they need more enforcement. We haven't seen that with the medical marijuana dispensaries, but towns have the option to have a 2% local options.
That's in the version that passed.
That's in the version that passed the House, the Senate. We know that the House Ways and Means Committee doesn't like local options taxes, so we don't know what will happen to that. Yeah. Crystal had a...
Thank you, Jeanette. I guess my curiosity is around the town's ability to opt out. Is that regardless of zoning? As you may know, Townsend has no zoning, so how would a town do that? You would just
have a town vote and say we're not going to allow any either grow facilities or there's really five kind of licenses. There's a grow license, a retail license, a testing license.
Dispensary?
No, dispensaries.
Separate.
You need to separate the medical marijuana completely from this. They're not connected at all. Currently. Well,
Well,
there's,
right, so I can speak a tiny bit to that. House Human Services did what we would call a drive-by of the bill, so we didn't take possession of it, but we talked about certain pieces of it. And the two things that we specifically talked about were prevention and the medical program. And at the end of our conversation, our request was that all of the language about the medical program get pulled out of the bill and be dealt with completely separately. So they're really, in the House anyway, right now being thought of as two very separate things.
Can you explain what the medical angle is?
What the medical, well, the
You said
medical
prevention
program
and
is,
medical were pulled out of the bill.
prevention was actually added, but there was language that would have changed the way the medical dispensaries are now currently being run. And rather than deal with that, they asked that all of that be removed and be dealt with in a separate bill.
right now, the dispensary, if you have a dispensary, and if this should pass, your medical dispensary is at a huge disadvantage because there are very, very strict regulations around the dispensaries. And that's for medical marijuana. I don't know if you're familiar with the way medical marijuana works or not, but you have to apply, a patient applies, gets the permission from their doctor, and then they apply to the state and they get a card that says that they can have medical marijuana, and then they have to buy it at a dispensary. So we have 5 dispensaries in the state. We have about 5,000 patients who use it. And what we did in here is say, if this passes, we need to true up those two things so that the dispensaries aren't at a disadvantage. And what Human Services did is say, we might need to true them up, but we should do it in a separate bill.
Yes.
No.
Yeah, we're still talking about
Yeah,
working on a separate bill.
Yeah.
Question back here.
I have a question about how you're anticipating spending some of the tax revenue. Is it going to be dedicated towards education and enforcement and roadside testing things?
No.
Or is it going to go into the general fund and be spent on education or something like that?
well, first of all, the general fund doesn't fund education, the education fund
Okay,
does. But our feeling about it was that when we passed the bill 2 years ago, 3 years ago, and 4 years ago, we had it divided up so that some would go to prevention education, some to the criminal justice system, and some to the general fund, I think. Our feeling this year is that it should all go to the general fund because we should not be anticipating where the greatest needs will be. The greatest needs one year may be in prevention and rehab. The greatest needs another year may be in adding more public defenders. So we thought that it made more sense to have the revenue go into the general fund and then for the two appropriations committees to weigh the needs of everything and make those decisions. So it does not, and it could be prevention, it could be education, it could be, but they need to weigh the entire needs of the state. And if we start putting separate funds for different funding revenue sources, then we run it up against problems every time we have a need over here. We've dedicated the money over here.
So one of the things that I would just follow up and say is, I think it's really important for folks to understand that this bill is in process and it has not achieved its final form. And its final form, if it passes, will be a form in which it can pass. Which means that, the language that's there right now, any of it may change if in fact there's a will to pass the bill, and it'll be Emily's job as part of leadership, if there's a will on the part of the leadership in the House, to get the bill passed. how do we get it passed? How do we get the most votes? Because at the end of the day, passing legislation is basically a math equation, okay? So the Senate, as you've heard our senator say, has passed this bill 5 times. We've never had the right combination of numbers and policy in the House to get it passed. And so what we're talking about right now, what Senator White is talking about, is the current status of what passed out of the Senate. We can tell you what passed out of House Government Operations, or not House Government Operations, House Government Operations, and went to House Ways and Means. I couldn't tell you because it hasn't been a priority for me yet. I'm waiting to see what's going to be passing. But I think it's important contextually for you all to realize that this meeting is important more so for you to tell us what is important rather than to ask us what is in the bill. Because what is in the bill right now, any of it can change.
Right.
Any of it can change. And none of it may pass. So.
And no doubt, all of it will change.
I think you were first.
Actually, I think he's
Okay,
longer,
great.
but
Oh, okay. I guess asking all of you and maybe asking the group, the biggest picture is what I'm trying to understand here. On the one hand, we can imagine a tax and regulate, a great boost to tourism, development of, markets, shops, industry, employment, maybe bringing younger people in to work in the various aspects of the industry. Sounds like, wow, this would be great. What a boost to, Vermont's economic development. On the other hand, the specter of retail shops with all the attendant, difficulties associated with retail shops and the perceptions that retail shops could pose for various municipalities or towns. So that's the other side. So I guess, and it's West River Valley Thrives, so it's this organization that's sponsoring this, and you have concerns, we all have concerns. So I guess that's what I'm trying to get at here, is that it looks like we have a tremendous upside, but then it looks like there are a lot of, questions and a lot of difficulties, and I think that's the picture that I'm trying to form in my own mind. I'm sorry, I should have identified myself too. Ken, SD, Planning Commission, Newfane. So, it's like, oh, how about Newfane? Downtown Village Center designation, hey, there we go, we have a shop downtown. Is that a good thing for us? Is that not a good thing for us? And so those are the big picture questions I have, really for all of you and really for the group.
I don't know if you want responses to that or not. I've been working on this issue for a long time, and we've had public hearings all over the state and testimony. And what we heard is that there are approximately 80,000 Vermonters right now that regularly smoke marijuana, and those 80,000 people are, if they buy it, they have a criminal record, or they could have a criminal record. So we have that downside, is that those people aren't doing it. We also heard from kids, and what we heard from kids, including our 13-year-old Pages in the State House, is that it was far easier for them to get marijuana than alcohol. Because if they wanted to get alcohol, they had to find somebody who was over 21, who was willing to go risk their own record to buy for them. And if they wanted to get marijuana, they just had to go to the bathroom at their middle school. Really, that's what the kids were telling us. So what we did is we said, let's make it legal and let's regulate it. And then let's make it illegal for kids under 21, the same as we do for alcohol. So I have those same concerns. I'm very concerned about kids, and tourism. I don't think it's going to be a big tourist draw. We're going to probably be the last New England state to do it. So I don't think it's going to have any. Massachusetts has already done it. I think Maine has done it. New York will probably do it very soon. Connecticut. I don't think it's not going to be a big tourist draw for us, as it would have been 3 years ago, but not now. So anyway, I have some concerns also, but I think my concern is that we currently have unregulated market out there. So when kids or adults are getting a hold of product, they don't know what they're getting. We don't know what's in it, what else is mixed with it. It could be good, it could be bad, so.
So
I don't know
I have
if anybody-
I have a little thing to add to that. So again, one of the other thing that we talked about in House Human Services was prevention, and we asked that a certain amount of the tax revenue that comes in be dedicated for prevention work, and capped at I think $6 million, and I can't remember what the percentage was right now. But the other thing that we discussed a lot was the advertising regulations and what could go on the outside of stores, and I think that's kind of crucial to making sure that it's, you know, not done in a way that advertises falsely to youth.
Yeah.
And that was one of our top concerns.
In relation to that, how do you plan to make that happen? I mean, there's a board, just you get somebody on the board who's really savvy with regard to
Well,
marketing.
we can have, there's language in the bill that, about how you can advertise.
Yeah.
And looking to what is done with tobacco, for advertising is a good jumping off place. So I mean, I think that there's plans to address that very directly in whatever gets passed.
He had a thing.
The state's been waiting for a while.
And so is he, and go ahead.
We have posts blocking us here,
Yeah,
so we
yeah.
can't really see. Everybody was waiting.
The legislature's spent a long time thinking about this and studying it. And I understand the concern about regulation and quality and all of that, but it seems to me that in order to pass something like this, things get broken down into pieces and farmed out to different committees and areas. And how does a legislature exercise leadership in keeping this big picture about going forward? What are we learning about this? What are the upsides and the downsides if this were to pass and people were actually finding this that accessible? You understand what I'm saying? How do you get everybody on the legislature to see the big picture and not just having it farmed out to different committees that have appropriate responsibilities, and that may even be politically savvy, but who's keeping their eye on
So
the ball?
I'm happy to answer that
Yeah.
from the House perspective.
Yeah.
When we talk about this bill, we're actually talking, when you ask that question, you're actually talking about all legislation, really.
Yes,
Because
yes.
this legislation, I think, was maybe in the House on the leadership team when we first heard they were going to pass this piece of legislation, and we asked our committees, which we always do, let us know as a leadership team who wants to have some input into this bill. And I think this piece of legislation had more committees who wanted to take part, or at least have their say in this than any bill we had this year, because it is very comprehensive and it touches on a lot of different areas. So when you ask that question, you're actually really talking about how we operate as a body and as a legislature in general. So we actually count on our committees to be able to, if we didn't have Human Services looking at the pieces that we asked them to do, and Judiciary looking at the pieces that they had to do, we aren't going to get a fully vetted and a comprehensive bill. So that is an appropriate process for us. Once the committees have gone through that process, then it will come to the floor. A very comprehensive bill will come to the floor if the bill's, made it out of all these committees that it goes to. It'll come to the floor, and then the full body will decide. And that's true of all legislation.
So are you saying at the end of the day, the legislation won't be just tax and regulation?
No.
Because that's my concern, that as it gets boiled down to tax and regulation, those other things that are comprehensive, where do they get embodied? They're not in the legislation.
What do you mean, like
He's
the
looking at
prevention?
yours.
You mean the prevention part? And the- Well,
Ongoing studies, tracking it.
well,
That all
I can tell
happens
you
in
how we dealt with that, is we had our Health and Human Services Committee look at it. They chose to put the whole prevention piece and the tracking and all of that in a different bill.
And that's also before the legislation?
No, that's passed.
It's passed.
That's
It's passed and it's been signed.
Oh, it's being signed tomorrow.
Oh, it's being signed tomorrow, so that's done. We asked our transportation committee to look at roadside safety.
Okay.
They looked at that. The Ag Committee looked at this. I'm on Judiciary, and that's where this happened. Government Operations only looked at the board, the makeup of the board in here and how the board would function, because that's one of our responsibilities. So we did the same thing. But just because all of those pieces may or may not be in the bill, in the particular bill, that there's a
Doesn't mean they're not
broader,
fully vetted.
right, they're fully vetted and they're someplace else.
And Emily, you then say what you said before, which is this is not atypical, this is really how the legislature
Well, because
functions.
it's so comprehensive that so many committees felt like they needed to weigh in on this piece of legislation. So that's why, I mean, I'll tell you, that's the main reason why it didn't make it out in any form this year, because it is taking a long time for legislators and committees to be able to get to the place where they're comfortable with the language that's in this bill. And so we just haven't completed that process yet.
But that does happen with all
It
bills.
does.
That it happens that way. It goes to different committees and.
Comprehensive legislation. I mean,
Right.
some just go to one committee, bills, but
very-
many times you'll see bills go for 2 or 3 committees. It's just, this one's a little unusual because it went to quite a number. Well, it hasn't had possession in many committees,
yeah.
but I think your committee probably didn't weigh in on it.
No,
but
and then you
most
have
did.
people like me, it'll come to the floor in a comprehensive way, and I'll go, not this and not and this
Yeah.
and that, and let's ask questions and amendments and this kind of thing. So.
And I'll just follow up on that piece, what you just said, which is really important, that we follow this legislation as best we can while it's in the development stage. And if it's important to us as legislators, which I think for all of us, we could probably say this is pretty important to all of us, to make sure we understand it, we will start looking at. So if I were a legislator who said, I really want roadside testing, I would be following up with my fellow legislators on the Transportation Committee who was going to look at this piece of legislation from that perspective. So we do watch legislation.
Let's get over.
Hi, I'm Shelley Huber, and I'm Vice Chair of the Select Board for the Town of Newfane. But I have been watching the committee meetings online, and one of the questions I had was the regulation of the quality of the product. I know that that they have been, in the medical marijuana aspect of it, they've just been testing and proofing against each other. So where does the actual quality testing come through and that sort of thing regarding the state?
Agency of Agriculture. They have a testing lab for hemp and for other products, and they're going to be the independent quality tester.
Okay.
Both for the medical and so far, that's the way.
so far.
And the Agency of Agriculture is very interested in it, and their lab is already capable of doing it.
But it hadn't been done that way.
No, because
Yeah.
it's a weird situation because it's an illegal product
Right.
federally. So if you have your state doing certain,
Something,
it's a
yeah.
very, but the Agency of Agriculture, now that they're doing major hemp testing, can also do this. So they will be doing it.
Julianne had a question.
First of all, thank you for making the effort to come. And my name is Joellen Terrell. I'm the Executive Director of the Center for Health and Learning, and we're a 501(c)(3) that's a state partner to many initiatives that address priority health issues. And so when I speak, I'm speaking really focused on the health impacts of this policy. That's what I know the most about. I've been asked to testify on this bill many times because we manage the Vermont Suicide Prevention Center, which is a public-private partnership with the Agency of Human Services and many other private foundations and many individuals impacted by suicide. And better than 50% of all suicides have a substance use related component. And if you talk to the Brattleboro Retreat, you will know that marijuana use is the first and highest reason that they serve adolescent and young adult populations. So I guess my concerns that I want to understand better, and the reason I haven't testified is because I haven't fully understood the politics and process of this. Frankly, from a public health point of view, it's felt a bit like a tsunami coming at us because it's happening, as you've said, Jeanette, all over New England and all over the country. But I come from a public health perspective, and I think that everything we do in Vermont should consider the health impacts as much of a priority as the economic impacts, and those are completely interwoven, so it's hard to sort it out. But from a data point of view, we know that Vermont has the highest binge drinking rates among our youth and adolescents, the highest marijuana use, and the highest opiate addiction rates now in the country. Our suicide rates are 30% above the national average and have held there, and we're struggling to try and address them. And the only way we address them is with comprehensive approaches. So when you talk about comprehensive policy, that's what I think and I hear some other people in the room, want to understand better. What does that look like? How do we influence the process in a way that's really meaningful? I mean, the Vermont Department of Health, as you know, contracted with the RAND Corporation, who did a very comprehensive report and came out against legalization. Or Jeanette, you can give me, it came out with many deep concerns about moving towards legalization and commercialization. The American Medical Association, the American Psychiatric Association, and the American Public Health Association. And when I talk about the health impacts, the word prevention keeps coming on this end of the continuum, which is absolutely critical. How we set up a culture in Vermont and a community and with a set of norms that move people towards patterns of use that keep them healthy. But I'm also concerned about the expense and the cost of healthcare on early intervention, treatment, recovery. This has huge costs. And so while I'm not questioning the intentions and the thoughtful focus on how we tax and regulate and make this an industry that has quality control, and I understand those concerns, but I want to understand better how the House and the Senate are taking into account the data on the health impacts and translating that into policy, which includes a completely underfunded prevention system in this state. And to pass one without the other, to me, would be irresponsible.
So I would,
I thank you for being here to have this discussion, because the reason I haven't gone up to testify is because I'm trying to sort all of this out.
I would encourage everyone who has that same concern to read S-146, which is the prevention bill that we did get passed this past session. It's what Jeanette referred to earlier, where we combined the three boards that are functioning now on prevention work into one. And that's just a starting point. And what that new board will do with prevention efforts statewide is really the next step. And I believe that will be a priority moving forward for both the House and the Senate. So in terms of looking at what's already happening with that, I encourage you to look at that bill in particular.
And I think that it's whether marijuana is legal or not legal, there's an issue with it. And I know when we talked to the health department a couple of years ago, they said that they could, we were talking about tobacco prevention, and tobacco use has gone down among kids. And it's a thing.
Except with vaping products where it has
Well, yes,
skyrocketed.
Yes, well,
Right.
but that's a new thing, but
Well.
the tobacco itself, the use of tobacco itself, I understand, has gone down. And what the health department told us is that they can do a really serious campaign around tobacco and alcohol for youth. But they can't do a really serious campaign around marijuana use because it's an illegal product. I mean, that was one of the things that they were telling us. And so it seems to me that whether it's legal or illegal, heroin is illegal, and we have a high use of heroin in the state. So it's creating a culture of non-use among kids. And I don't think that's going to make a difference whether it's legal or illegal. I personally don't think so. But I may be wrong.
And I'll just follow up on what you just said, Joan, based on what Jeanette just said. The fact is that those statistics that you just cited, those are current, right? With marijuana illegal. I mean,
Yeah.
you know, and so we clearly have issues around prevention in this state and many other things. And so I really do agree with Kelly on that.
Yeah.
Look at our prevention bill. We need to take a stronger look at how we support our communities and our schools to provide education and to work on prevention in general.
And fund it, which is
And fund
also
it.
Right.
part of what we
And if I
addressed.
can just tag on to that, I think it's really important that those funds in this prevention bill get down to the actors who are working in the communities. The state is not going to do it up there.
That's right.
We're going to do it right down
Right.
here. We are struggling right now. We have 2 grants out that we're dependent on in order to start a completely new program of early intervention and parent support groups. These are big gaps that we've identified in our program. We need to get to the younger kids. We need to increase the perception of harm among these kids. These kids don't, the perception of harm is going down among our youth and marijuana use. We need to increase that perception of harm among our adults and our youth. And while tobacco use is going down, we're skyrocketing on nicotine-based products that are these electronic-based products, which are also able to use marijuana in the reusable products. I have statistics that show that for every dollar spent on substance abuse and addiction, up to $10 can be saved if you're putting that money into prevention. And that's an average, the $10. It's anywhere from $2 to $20. Also, 1.9 cents is spent on preventing and treating substance abuse. That's prevention for every dollar spent, and less than 1/4 of that goes into prevention. So we need to get that money down to the local organizations that are working directly with our youth in particular. That's really important.
Yep. So Steve, I think that's really helpful. At a high level, I'd like to know more, like what is the organization? What are the grants? Who are you talking to ensure that there are funds going in there? How can we be helpful in that process?
Yeah.
Like that is a great thing for us to hear more about.
And we'd love to talk more because we're all very well established. Deerfield Valley Community Partnership,
I mean,
Brattleboro Prevention Coalition, Greater Falls Connections.
I mean, I know these organizations, but what are the grants? I don't know what the grants are. I don't know if they're in the mix in terms of funding.
So one of the challenges of the way Vermont functions, generally speaking, is we have great coalitions of people in separate communities doing really great work, and they're all fighting for the same, in most cases, federal dollars, right? Especially when you're talking about prevention, because there's not a pot of money that the state offers. So what the bill that we passed is looking to do is to have this, well, one of the things is to have the state and this new board that's going to be formed look at the entire state and look where these pockets are
and who's doing what work and what money they're using to do it. And to come up with some best practices to see where there are holes, where there are communities that don't have anyone doing that kind of work, because that is still a problem. And part of the reason that we specifically said we wanted tax revenue from a tax and regulate system to go just for prevention is because right now the state is not giving any dollars to prevention, and almost all of the money that is getting funneled out into the community is federal money. So we want to provide state money so we can draw down more federal dollars and get more money out into the communities and start building up a network that is not just individual groups fighting against each other, because they're all doing the same amazing work. And if we can build more network between people and maybe have the state find a way to be more efficient in how it gets money to everybody, we're hoping that, you know, you don't need to be fighting against the community next door to be doing the same kind of work. So that's part of what we did in this new prevention bill, is try to look at the entire state and look at what is being done that is being helpful, and try to help build up all of our communities doing that same kind of prevention work. So, yeah.
Well, you guys had said that the money that you earned would go into a general fund, which would allow you the ability to use those funds where it was needed most. But it makes sense, I would believe, to put all the money into prevention.
If I can.
Education.
Let me speak to that.
Prevention.
Let me speak to that. When we fund in the state, as Kelly said, we have prevention, we have education, we have nursing homes, we have Medicaid, we have a lot of needs in this state. And if we start, in my opinion, if we start pigeonholing money from one source, right now all our sales tax money goes to education. That's gone from the general fund. So all that goes to education.
Well, you could split it, you could do 80-20.
But here's my point. Why not let our appropriations committees, who deal with this all the time and have to deal with mental health issues, prevention issues, substance abuse issues, nursing homes, Medicaid, broadband, all of those issues, they deal with it all the time. Let them figure out where the need is the most, instead of putting in a bill here. That's my
So we had,
if you don't have the health of a community, you have no community.
I'm not saying that it won't go to prevention. I'm saying that our appropriations committees look at the entire needs of the state, not just siloed needs.
But the state is salivating over the amount of money they're gonna make on the tax.
No, they're not.
When Colorado passed their tax bill, and $7 million in the first 30 days, light bulbs went on every politician's head. My name is Tom Abbots. I'm a member of the Lions Club. I'm 65. I've had 50 years in construction business. I hired and worked with shelters, helping young people transition out of substance abuse, domestic abuse, whatever, and give them an opportunity, clean place. 30 years I've been substance free. What I see from these young people, and this is a substance abuse issue, I believe that decriminalizing it is very important, because that takes away a big stigma from these first-time users. But if we educate these kids from early on, and when they start getting into the higher grades, high school, where they're looking at their future, offer them industrial schools, trade schools. Colleges aren't for everybody. Colleges right now aren't teaching our kids what they need to know to really perform. We can't have everybody using paper clips. We need carpenters, builders. These young guys, when they work for me, they're working with saws, they're working with heavy equipment, they're driving trucks, and they realize very quickly, because I'm on their ass, so to speak, that their safety, my safety, and the public safety is very important. And if you're impaired because you've smoked a joint at lunch, the education is a huge thing in this country. In this state, new thing. We have, like you said, the highest opiate in the country. Marijuana is a gateway drug. It starts impaired, hey, I'm a child of the 60s. I was an abuser when I was young, but I saw what it did to me and I saw what it did to other people. The loss of productivity, the loss of comprehension, the inability to learn is all keyed to this. Now, great, I've got elderly people who are suffering from chemotherapy or other diseases that this can help. But when you're 15 years old, 13, 12 years old, you don't need this. And the funds that are going to be generated from your bill, and I'm very happy to hear that you're separating the financial from the humanitarian and the prevention and whatnot. If we put that money into the education right off the bat, it's going to cut the cost of health, psychiatric. It's going to reduce the cost of the legal system, because now we're dealing with these kids before the horse is out of the barn, not afterwards. And I hear a lot of this is after. It's very difficult to take somebody back to normalcy after they've been out there.
I'm not saying I disagree with that, but I'm saying my point, and it might change. We might put some of it into different pots of money. I don't know
We've asked that
what will
already.
happen, but my perspective on it is that we should let the Appropriations Committee that deals with all the needs of the state. They deal with health care, they deal with mental health, they deal with substance abuse, they deal with broadband, they deal with nursing homes.
See, that's the general fund. Everything gets drained off from it and siphoned off.
No, it doesn't.
If you deal with these kids at the early ages, and that is the best prevention.
Yes, I don't disagree with you, but
I apologize.
Has anybody studied how the tobacco settlement money has been used in this state?
yes,
Which was largely at
Yes.
the same time that was passed, it was discussed that that should go towards prevention.
yes.
And I think if we were to study how that was used, a very small percentage of that over time has gone towards prevention in any.
Some of it's still going towards
Yeah.
prevention, and some of it is going to be used to fund the new positions that were created in the prevention bill.
I think it would be a good idea to use that as a case study, to really look at how that revenue and funding was used and/or, could have been better leveraged.
It hasn't all been spent yet either, it's still being spent down.
Yes,
So-
no, I
Yeah.
understand that, because we administer programs
Right.
that, access that money. May I offer a couple of?
Can I just
There's
point out
there's
one
someone
thing?
behind
Yes,
you who
okay.
has not had a chance to speak.
I just want to point out one thing though. If we said that a certain percentage of the revenue generated was going to go to prevention and education, it might end up actually being less than if we put it into the general fund and then people like Joelle and then you come up and testify, there might end up more going into prevention and education because the need is greater. But if we say that there's going to be this much that goes in there, that's the way it's going to be. So that's my point, is that let the appropriations committees look at it and figure out where the need is and where they should put that money. They may put in more money than the percentage.
Couldn't they add more money to it?
So, right or wrong, I would just say, I would
Yes.
go back to my
Yeah.
original comments, which is math equation. right? So I am one of the people that will not vote for, I really believe we need to move into the tax and regulate system. I think it's very important. I don't support where we're at right now. I think it's not great. I think we do need to have a much better sense of quality and measures, but I won't vote for tax and regulate unless there are funds that are dedicated to prevention, to law enforcement training. I mean, there's a number of things that happen when we take actions, and so I look for the nexus. I certainly think that Senator White is correct around our appropriations committee having a much bigger picture. Everything feeds in there, but we're taking a new action to sell a new thing and generate new tax revenue, and I personally think it's appropriate to tie that. So my vote will be tied to that.
Right.
Which would be, one of the problems that Emily's trying to solve.
Or the benefits.
What equals different types.
Because last year, there was money dedicated, in the last year's bill, there was money dedicated, and we couldn't get the votes in the House.
When this bill left House Government Operations, there was money or language in there dedicating a certain percentage of the tax revenue to just prevention work. It's only prevention. It doesn't have anything to do with recovery or treatment. And I can't remember what the percentage was now, but it was up to $6 million. So yes, you could always ask for more, but at the very least, you'd be getting something. And right now, the state isn't budgeting anything of their own dollars for prevention.
What's projected
Can we let this
revenue
in the
first?
We have no idea, because when Rand projected it from the study before, there were no other states around doing it. We have no idea what the projection is. It could be pretty minimal.
This lady in the black in the back has been waiting.
My name's Heather Miller. I actually came here with the camera crew today, but the whole prevention thing and helping children be educated. I've done work with DCF, and I've been in the community of children at risk for like the past 7 years in Brattleboro. I worked through Boys and Girls Club for a little while. And there is a preventative program that I worked for through my college years where we wrote and directed and performed skits done by the youth. And shared personal stories of overcoming addiction or having been in abusive situations and coming out of them. And maybe there's a way to get these programs in the schools so that the actual kids are possibly writing their own work, or we have a way to fund a program where we can, create a acting group and we go and do that, or, an adult helps kids in the local area, even like Marlboro, who knows? But it's just an idea, and if anybody knows who I would want to talk to get that program.
Because that gets right back to funding. I've had that, we are based in the Leland and Gray School, so we've had that conversation with Jessa Rowan, who runs a wonderful program, but she also comes out of a program that she was involved in New York City, where the youth do these ad-lib sort of programs, and a lot of issues come up. But what's the issue with it? Funding. So we had a meeting about this, and where do we get the funding to support something like this? Because it does take staff time, it takes some resources, not a lot of funding, but again, our current funding doesn't address that, but it allows us to reach another type of young person.
It wouldn't be that expensive though. It would take some gas and some like someone to organize, writing the skits and a space to rehearse and put them on.
It's minimal.
Yeah.
We run on small budgets, but that small piece right there, we can't just say, well, this grant line item that is allocated for this, we're not going to move it and do that. We can't do that.
Right.
So that's where those sort of creative programs are magnificent, because they reach so many different types of our youth. And that's what we need to have more flexibility.
They're more successful than the DARE program because it's not like an adult telling them, oh, don't do this, shame on you. Yeah. It's kids coming forward and saying, hey, I made all these mistakes. I don't want to see all my peers make the mistakes too. So it can be powerful.
Thank you for the work you've done with youth.
Yes, thank you.
A couple of things. To offer constructive suggestions about thinking about the prevention and education and the continuum of care across human services. First of all, I think we have to take a lifespan approach because adults are absolutely critical in establishing the norms in a community. I self-funded, partly and publicly funded from our revenues from CHL, where we can put aside some unrestricted money and use it for proactive prevention kinds of activities. A trip to Iceland with a delegation from Vermont to learn about the Icelandic prevention model in March. And Iceland has taken their substance abuse adolescent rates, and their whole focus was on delay, delay, delay. Because the longer you delay substance use, the more likely you have of offsetting addiction later on. And they took their adolescent alcohol use from the highest in Europe to some of the lowest in the world. They did it over 25 years. There was a conference of 190 people, 19 countries, and they're starting to work with other countries on the model. And so I think the underlying understanding right now in the prevention field is that we need to look very, very clearly at risk factors and protective factors. We need to systematically identify the risk factors and mitigate them, decrease them through policy and program. And it's got to be policy as well as program. Because we can throw lots of good programs out there, and you know, we did it for 20 years with Act 51 alcohol money in Vermont, and we didn't show any outcomes. So we have to, you know, mitigate our risk factors, systematically identify the protective factors that we want to support, and then put our resources systematically towards the protective factors while mitigating the risk factors. And that is what shows outcome in the prevention field. So as you're thinking about this, it needs to be, I think, a very strategic approach. And what Iceland did, which really impressed me, because we have not done this in Vermont systematically, is they took research, data, and surveillance, and they put it together with policy. Their municipalities, their towns, their cities, they're a very small country, are very involved. And they funded through municipalities. I'm just saying that's one model. They have their regional planning commissions, their select boards fully engaged. This can't just be a prevention effort coming from one program over here. And they put their research, data, surveillance, their policy, and their program people, the people who deliver the services, all together in the same room, and they worked all on a common direction. And one of the things they did was really focus on family engagement, because you've got to have strong families, and you have to have families that understand that substance use in adolescence on the brain is simply not a good thing. The other thing they did from a policy perspective is they looked at access. And retail density is really a concern, both with alcohol and with marijuana in the prevention industry. And I was recently at a conference where a prevention director, maybe from Windsor or Scottney or Burlington, presented a slideshow, and she showed all the pictures of vaping, of juuling, of alcohol in the community, the small community where these kids are growing up. And we have to think about the impact on the normative thinking, behavior, and attitudes of the adult and the children and youth population. So advertising, I mean, Iceland had the ability to, not outlawed, what's the word from a legal perspective? They banned, thank you. They banned alcohol advertising in the public. There's no signs for alcohol advertising. So access, advertising, normative messages, working with public messaging campaigns to educate the public, and then the risk and protective thing in a very strategic way where you're using data. If you're going to have a program, let's show that the program has outcomes. So we're really surveilling, providing good surveillance around where we're putting our resources, because they're so limited.
You know, I think that hopefully this new prevention board will.
It touches on all of that. We heard a lot about the Icelandic model this year, and had some people come and present
on how that's gone. And we use that a lot in our thinking about how we structured this new prevention bill. And we talked about that prevention is really a lifetime endeavor. And we added youth onto the new board that's going to be formed, and someone who represents the older Vermonter population, because you can become addicted at any age, and maintaining connection to your community is something that is important at all stages of life. So that is something that we very much had in mind when we were working on that.
And one just final thing about the funding is that I've heard the word grant used here. It is so challenging to go from one grant to the next. You know, you might have 6 months, 12 months, 36 months, and then it's over and you're spending all your time. And it's a competitive system. We cannot engage and grow a true prevention workforce under those conditions. I have seen marvelous people do it for 2-3 years and leave the state.
It's not sustainable.
Yeah, so we've got to think beyond. Grants are great for innovative programs that we want to disseminate or pilot, test, and then decide if we want to fund. But we have to have some sort of sustainable funding, and use grants only as a incentive for growing our efforts.
So I'm going to have to leave.
Yes.
I have to go to work, unfortunately. But I really appreciate the opportunity to come and hear this. And I would encourage all of you to think about testifying. It's your state house. It's your work that we're doing. And so your words, your thoughts, the more specific, the better. Around these policies as these are developing are really valuable. And for your representatives and legislators, the more specific you are able to be in terms of this specifically would be helpful. This specific piece will hurt us this way. It just helps us really kind of understand how our districts are going to be impacted, which is helpful because we're looking at a whole bunch of things, and then this will come. Somebody like me is not dealing with this policy until really just before it's coming to the floor, and so the more feedback that I have specifically, the better.
Is
so,
that planned yet, the testimony part?
Well, it won't be until January.
Right now it's in the Ways and Means Committee. The Vermont Legislature has a really fantastic website. You are able to go on it. You can go onto each one of the committee pages. You can see what the agenda is for the week. You can put in a bill and you can follow where the bill has been. In the committee page, you can see, okay, they're going to take testimony on Tuesday. The chair's email is there. The committee assistant's email is there. And it's very easy. You just send an email and say, I'd like to come in and testify on this specifically. You really want to bring something that will be helpful. But that's a very powerful. When you come in and testify, people are listening to what you're saying.
And you can also read other people's testimony.
Absolutely.
We post testimony
Absolutely.
that's written to us.
Yeah. And different versions of the bill and this sort of thing.
Yeah.
So.
Vote.
Thank you very much. I'm going to have to run away.
But it is important when you come to be specific, because when we're dealing with the bills, we have to write something specific into a bill. So just being in favor or opposed is not as helpful as being very specific, very specific feedback. I have to say that one of the problems with, I think we should do some sustainable funding, and we've over the past 2 years have done that around mental health. We have been putting a lot more resources into mental health because we have underfunded our mental health system so dramatically. So we have been doing that, and this budget also continues that. And I think that this is another area where we need to have that sustainable funding. One of the, when you were talking about making sure we had outcomes, the programs had outcomes, I serve on a committee called the Government Accountability Committee, and it's all around results-based accountability and results-based budgeting. And one of the things that we see is that you have all these different programs, and people don't want their program. Every program has advocates, And even if there aren't outcomes connected to those programs, there are advocates for that program. And it is really hard to defund them. Once you've funded something, it's really hard to stop that. We had an example of a program that was designed to reduce teenage pregnancy. And they were funded, and they came in and said, well, you gave us $100 last year, we served 100 people, if you give us $150, next year we can serve 150 people. And we said, yes, but have you reduced teenage pregnancy? No, but we have other great results. Yes, but your goal is to reduce teenage pregnancy, so why would we keep funding you? But there were advocates for the program, so it's really hard. I mean, I think it has to happen, but the decision makers are in a really tough position to defund when they find out that things don't work.
And we wrote into the prevention bill that people needed to do research-based accountability studies to show that their programs are doing what their programs.
I would say that we are much more focused on RBA in the legislature than we ever have been.
Yes.
That we really are starting to say, what is the problem we're trying to solve?
And are you getting an outcome?
Are you, yeah.
And keep
How
in
do you
mind
measure?
that prevention is a long runway, so we
Yeah,
have
yeah.
short-term, intermediate, and long-term
Yeah.
outcomes. And
Exactly
some
right.
of those short and intermediate outcomes lead to the longer outcomes. But that's what lays the base for evidence-based
Yes.
practice, and I think that's what we need to be
Yes.
held
Yes.
accountable
Yes.
for.
Agree.
Yeah.
I think it's also important to recognize that we're one of the players in it, and there are so many factors involved in it. So we alone cannot do this. We need a change in the social structure, in the political structure, in not necessarily here in the state, but when we're looking nationwide. We need to look at socioeconomics. We need to look at opportunities and jobs. So when people are trained in various ways, are there jobs, are there opportunities for out there? Do people have hope? That's really important to keep in mind. So what Joellen says, it's really important. We're looking at the long term here. That's why for us, getting in and doing that early intervention work, working with the families is really important. We're not looking at maybe changing the rates of vaping, of e-cigarette use next year. That's very short-sighted. But if we're looking at getting in among the kindergarten, the first graders, and doing age-appropriate evidence-based education and working that through over the years, we have a 5th and a 6th grade program which gets us in the classroom a couple times a year. That's not enough. Mm-hmm. We need to also be doing social-emotional work with these kids and engaging them in many other ways. And then we need to be patient, and we need to say, maybe this won't change next year, but let's give it a few years and be patient with it. So let's not just withdraw that funding just because we're not seeing that change tomorrow.
Other concerns, issues? But, so make sure that you get your voices heard, and I do have to say that this one is pretty far along. I mean, it's in Ways and Means now, and Ways and Means only is supposed to look at the revenue, so they're not really looking at anything else in this bill.
Which one? The tax and regulate.
The tax and regulate.
Is far along, and so then that's what I'm concerned about is how do we ensure from the health impact side of it that happens simultaneously.
I'm not sure I understand what you're doing. I mean, how,
Well, I think what we did, right, I think what we did last year was just the starting point of that, and I don't,
Yeah, we've already passed that legislation.
right, and I don't think that there's going to be, nobody thinks that, well, we've done that and now we're done.
Right.
I mean,
That's right.
That's
That's what this board is for.
yeah, pushing it forward is definitely a goal and at the forefront. So I don't know if I can assure you beyond just saying that there are a lot of people concerned about that.
Yeah.
And it's
So
going
just
to continue
to
move.
make sure everybody understands, the tax and regulate is very far along. right now, as it stands, the funding revenue goes into the general fund.
That, the way it is right now.
As it passed the Senate.
As it passed the Senate, it didn't go
Okay.
anywhere. It just went into the general fund. And I have to say that 2 years, the last 3 bills that we've passed, we did divide it up. We put 30% into, or 25%, no, basically 30% into the judicial system, which meant maybe more public defenders, more judges, more, because we need to beef up our judicial system, which includes law enforcement. And 30% into prevention education, and 30% into, I can't remember, maybe the general fund. And that didn't go anywhere. That passed the Senate. It didn't pass the House. So this year, we decided not to do that because it didn't go anywhere.
And the House has added language about
Back.
dedicated funds for
Right.
prevention.
So I would also say that this is quite a different sort of process for the Ways and Means Committee, and they really felt like they couldn't even do a lot of early work on this bill as it was before it was coming to them, because it was sort of a new structure for them. This is a new tax coming in, and this is a new way to deal with revenue that that really to sort of paraphrase what the chair of the House Ways and Means Committee was, this is new territory for us. And so they really felt like they are going to have to dig pretty deep into this and see where they're going to come with it. I honestly have no idea what it's going to look like when it comes out of Ways and Means. But even when it does that, because I'm pretty confident that it is going to come out of Ways and Means. It's not like it's going to die in there. The bill did not die this year. It is moving forward.
Right.
There is, if you don't know, there's quite a bit of support to move this legislation forward in the state of Vermont. We hear from constituents all the time that we want to see a tax and regulate system. We're now at a place in time where we have done the work we've done on marijuana. Now we want to look at this next, this next stage of it. So I think that this will move forward. But what it looks like is not even going to be what it looks like coming out of Ways and Means. Mm-hmm. So give your feedback, especially if you're looking at it from a banking perspective, you're looking at it from a taxing perspective, a revenue perspective. Share your feedback that way, but share your feedback with your local legislators and folks on committees, mm-hmm. because there will be amendments, on the floor to this when it comes. And then there will be a truing up between the House and the Senate through conference committees and stuff like that to find out what we can do to, improve the legislation until it gets to the point where we can all support it. And we're not there yet. That's clear.
And even what passes, even what would end up coming out of a conference committee between the House and the Senate will change next year. It'll change. I mean, we don't pass legislation and then
walk away.
Then it just ends. That's the end of it. So we, for example, passed legalized medical marijuana, or cannabis for symptom relief is what it really should be called, not medical marijuana. It is not medical marijuana. It's for symptom relief. And we did that in 2004. And since then, we have been making changes every single year. We've made some changes. In 2010, I believe, or 8 was when we passed the dispensary bill to allow the dispensaries. So we make changes all the time. So even what ends up coming out of a conference committee, if it gets signed by the governor, is subject to change. It isn't written in stone once it's
That's
there.
always true. And the more comprehensive the legislation, the more likely it is to change in future bienniums.
Yeah. But from your municipality's perspective, you should know that there is actually, I believe the House changed it, so it's now an opt-out. I mean, an opt-in
now, I believe. That's
instead of
the way
an
it left.
opt-out.
That's the way it left,
And I think that will not, the Senate
is
will
not happy with
not,
that.
we will not, I don't think, accept that. that means that a town would have to have a townwide vote to allow an establishment, as opposed to the opt-out that we put in was that a town would have to have a vote to not allow. And what we're seeing in Massachusetts is that they put in an opt-in provision. And what's happening is, looks a lot like bribery. So establishments are coming to town and saying, well, let us, you vote to let us come into your town and we'll give you $300,000 for your new fire truck, and we'll give you, it looks to me a lot like bribery, and I don't think we want to go in that direction.
And I would just, so the gentleman over here earlier asked, you know, what is right for my community, and is this right for my community? And when I'm not in Montpelier, I'm a town clerk and very much involved in municipal government in Londonderry. And I would say start your conversations in your communities now.
Yeah.
And have those conversations. Is this right for our community? And if it's not, pay attention and know what steps you have to take to make sure that the whole community knows that and has a chance to weigh in. Whether it's an opt-in or an opt-out, know what that process is going to look like. If you have the opportunity to revise your zoning bylaws and want to address, having establishments in your town, start now.
Yeah.
Start looking at what policies other communities have written into their bylaws or into their town plans. There are towns who have already started to address that. Talk to your regional planning commission and see what resources they can help you with. This, we are doing what we can do, looking at the entire state and crafting a law that's going to address the overall system. But you as municipalities have the power to weigh in for what is right for your town and your community. And I just can't say enough that is, to me, where the rubber hits the road, and start immediately.
And I would follow up on that saying that many of you know I'm a school board member, have been for a really long time. You should be also reaching out to your school boards and saying, what are you doing in your schools?
Right.
In
for
your
prevention
region,
and education.
For prevention and education. That's something that's really important, I think. Talking to your local elected officials is really critical at this time.
And I was going to add on to Kelly's comment about the starting the conversations in your communities about what you want there and what you don't want, and looking at, there are actually 5 different types of licenses. So you could say in our community it might be appropriate to have a grow facility, which is out there, but no retail facilities, because the little village of Newfane or Townsend having a retail store there, that might not make any sense. So you can
right.
vote to have, your town can vote to opt out of allowing any type. You don't have to say we're going to either allow it all or none.
Right.
You can say we're not going to have any retail facilities, we will allow a grow facility, and there's really some strict regulations around the grow facility, so it isn't like it's going to be downtown on the green. But but you need to have those conversations, and you should be having them now, like Kelly said, because if this bill passes, whatever passes, it will parts of it will start to become effective at different dates, and you need to have those conversations.
Your name was Tom?
Yes.
The idea of a tech school or skilled trade school is a great idea. Where my hometown is Bradford, where they have Riverbend Tech School. They teach culinary, cosmetology. They have the teenagers build houses. It's been really successful.
Well, it gives the young people hope.
Yeah.
That there's something after they get out of school and their life is regulated by their parents and their teachers. And putting money in their pocket, being able to earn, gives them self-esteem. It gives them purpose. It gives them a direction. And with all of that, drugs and alcohol fall to the side.
Mhm.
Life takes over.
Absolutely.
And the ability to enjoy life. And that's the point I was making. And I'd like to apologize. I get very passionate about this because I've seen so many lives. I was working for a guy down on Flat Street when the wall was in effect. And the amount of drug use that was just out there in broad daylight was to the point that we in the shop intervened.
Yeah.
And then you get into another whole legal issue. But I know it's a very difficult thing for you folks. I appreciate what you do. I've seen Emily up at the Montpelier when we were there with the Lions. It's a difficult thing being a politician. It's a very passionate thing because we're losing our youth in this state. They're moving away, or they have too much spendable time on their hands, and they're not being productive for themselves or for the community. And when we lose the youth, we lose the community. I'm sorry.
Can I address you? I'm the school social worker for this district, and we do have access to the Career Center in Brattleboro.
Yeah.
And we also have a program, it's a work school program. I think we're always looking for people who are willing to be some sort of an apprentice. What is the, if you are the apprentice, what is the person? A mentor to I actually know somebody who could really use somebody in your field. So
I'm a good example of what not to do for the kids.
Right, perfect. So
I'm not a good example.
but would you be willing to have a conversation with?
I would always be. I mean, I've taken a lot of young kids under my wing over the years. And actually, we have a young man who just got out of the Air Force who went through the Brattleboro School. He was from a troubled home. We sort of took him under our wing down to Stanley's motorcycle shop. And, you know, big bad bikers. Well, we put that young kid on the straight and narrow. He went into the Air Force. He is the head mechanic for his squadron in South Korea. And he's home for a month.
You're here.
And, yeah. And this is an example of each of us, you know, it takes a village to raise a child.
And it gives them more options to make choices for themselves too.
Exactly.
The way they do it in Bradford is that you can opt out of language courses to learn a skill that you can actually.
We all can't be
it's all
English
useful,
lit
but-
majors, you know, but that doesn't diminish our role in life. You know, we can contribute a lot in other ways. I'm sorry if I was.
There is no need.
Okay, there's no need to apologize.
Absolutely.
It's a huge
So in
issue.
terms of the committee impact, right now, the place to focus energy at the House, the State House, is with which committees?
Well, the bill is in Ways and Means right now.
Okay, in the House.
Mhm.
Yep.
And what they're really looking at is the tax issue.
So
It's, I mean, that's what they should, that's what they should be
And how the tax will
looking
be apportioned? or
No.
No?
at. No, that's an appropriations committee issue.
Okay.
Now, it did, in our, in the Senate, I don't think it went to appropriations because we didn't have any money.
that's right.
So it didn't go to appropriations, but in the House, if they keep the Senate bill had a 16% like a sales tax on it, 16%, and then the 2% local options tax. I don't know what they'll keep on there. I know that the House doesn't like local options taxes. I
The Ways and
believe
Means Committee.
the Ways and Means
usually a-
Committee doesn't like
it's a
that.
challenge with that.
We thought
They
it
won't
made
do
more
it.
sense to do it that way than to collect it at the state and then redistribute it to the municipalities. But if there is some money generated, then it will have to go to the Appropriations Committee, I would assume.
Yes, sir.
So that's,
But again, reaching out to your local legislators as well, right? It's really important.
and there
Or
will
if
be,
there's an area that you're, if, you know, prevention is what you're concerned about, then reach out to the Human Services and Senate Health and Welfare, wherever the appropriate subject matter lies, just keep reaching out to people.
Right, but know that this isn't the only vehicle for those things. Because the
Yeah, right.
prevention bill, I thought it was genius of Senate Health and Welfare to do it that way,
It was sort of a preemptive strike.
right.
It's like, we see this coming.
Right.
And we want to have
Yeah.
something in place working, like you said, everything in the same direction. And
Yeah, and not putting it
Collaborating
in
and-
here, not putting it in here, but making a whole separate big deal about prevention instead of just having it be part of this bill. It was much more impactful, I believe, and made much more sense. So it doesn't have to be this bill that you're focusing on. The same thing with roadside safety, road safety. It doesn't have to be in this bill. It can be in a transportation bill, it can be in a separate bill, which is what we chose to do. I think the House put back in
the
roadside saliva testing and primary seat belts and who knows what else. Sorry.
We have been looking hard at it.
It's good because
Not sure what
when
primary-
you legalize something, it opens the floodgates up, and then trying to catch up with legislation. You're gonna have to fine tune any legislation
Well, yes.
as you go along.
Yes, yeah.
I get that. But opening the floodgates, similar to Colorado, they started finding a lot of other social problems were being developed because of
But
the endorsement.
Colorado did it in a
Yeah.
really bizarre manner. Let me
Yeah.
tell you,
learned a lot.
Colorado, well, it isn't just that we've learned a lot. We don't have voter referendums in Vermont. Colorado did it by voter referendum and changed their constitution. They can change their constitution by a voter referendum. So they did a referendum. They had no debate at the legislative level at all about how to implement this. That is the exact opposite way that we do it. And if anybody ever tells you that we should have voter referendums in this state, tell them they're crazy. Because that's the way really bad pieces of legislation happen, and then you have to play catch up and try to implement them. So that's what happened.
I just used Colorado because it was the first state to
I know.
open up the financial end of it.
Yeah.
Yeah, but we know the impacts on Vermont are very different
Yeah.
from what happened in Colorado. We know that. I also want to just say that we've talked a lot about prevention, education, all those things, but there are many other aspects to this bill
Yes.
besides just even roadside testing. That's a piece of it. So transportation, banking. That has been a pretty big question. This is illegal. Nationally, it's a federal issue. So how do states deal with banking? I know you guys have looked into that.
Actually, we have a local bank that the board of the local bank has just voted to allow the bank to invest and take money that's
Very different approach. We haven't seen that before. It's a good.
It is, there's a statewide credit union that actually also does it,
Yeah.
and it's a matter of the way they organize themselves, and there's also federal legislation there are now something like 30 states or something that have either medical marijuana or legalized. So those states are getting together to try to get federal legislation so that if it's legal in a state, then the FDIC won't shut down the bank because of it. So
And just a couple of other things I want to make sure that that we're thinking about, and that is, how do we support local farmers?
Mhm.
We all, I think, have outreach from our farmers who are really struggling. I mean, dairy is really, it's a very difficult industry to be in today. Farmers are really looking for other things to be able to do. And we want to make sure that we're trying to support our local farmers. That's what we do, right? So, and then related to that, we started to say, hey, what's the impact on our climate, honestly, on growing marijuana? It is generally done inside. So how can we mitigate the impacts of, large.
A lot of energy
Yeah,
consumption going on.
yeah. So those are all really important things that we're looking at, and there's others, but those are things that are popping into my head.
And you should know that there's a lot of conversation about corporate
Yeah.
takeover, big corporations taking, we have not allowed that here. It's very small facilities. We do not want, we want to support our local farmers. We want this to be a Vermont sized.
Local farmers, the reintroduction of a different crop is key to modernizing farms today.
Right,
You know, and
Yeah.
but we want to keep it Vermont sized instead of having
exactly.
the Monsantos or the Bushes or the Anheuser-Busch's come in and take over. So there's very small size limitations here.
Other states have tried really hard to keep corporations out of this, and it's been very hard to do. So
Yeah.
we're really looking hard at that to say, I don't know if it's possible, but the way you can do it is to put your focus on your locals to give them the first
Well, and to
shot at it.
limit the size. You can limit the size because Anheuser-Busch isn't going to come in and set up a facility if they can only have a very small facility. They want to do it in a mega way. So you do it that way, and I believe by limiting ownership to Vermont residents, investments. So there are ways of doing it, and it's in here.
We're looking at it.
We take, whenever we pass a bill, and I think Emily alluded to this, that we take it all very seriously, and we look very in a lot of detail at each of the issues, and so.
Just to underline the value of this conversation for me, because I think just getting to know the legislative process and the way that you've outlined it has been extremely useful. Just to get the fine details of how a bill gets passed with respect to an issue that's controversial or concerns many people, and then to hear the way you've described it from both sides of the legislature, extremely useful to me, and I suspect for others. And also that contrast with Colorado with respect to the referendum, and then on the other hand, the careful vetting that all of you are doing across the committees is very enlightening. So thank you.
Well, you're welcome. Thank you.
I'd like to second what Ken just said, and thank you personally, Jeanette, Emily, Kelly, Laura, for your insight, for sharing this, for educating all of us, and for all you're doing, and for your generous time that you've given here today for all of us. Thank you very much.
Can I just add one thing, that when not just around this issue, but whenever there's an issue that is of concern to you, you should be paying attention, and the time to pay attention is when it's in a committee, because that's where all the work is done, is in the committee. And once it leaves the committee, your only opportunity to have any input is to get somebody to do an amendment on the floor. And floor amendments are, in the Senate, floor amendments are really, really hard to pass, because if a bill comes out of a committee, you assume that they've done their work and they've looked at it. And so for somebody to then have an amendment that's substantive is not well received. So your opportunity to have input into any bill at all is when it first hits the committee. And that's, you need to pay attention if there are issues, bills. I don't know what other bills you might be interested in, might not have anything to do with this, might be on how you're going to fix the bridge over there. I don't know, but whatever it is, at the committee level, right? I mean,
well,
and
it
that's
is
the same
important,
in
but
the
I would say it's the same in the House in
Yeah.
general. But I would say that we do get a lot of amendments that get support of the committee who has sponsored the legislation originally. So, I mean, it really doesn't mean you can't change the bill once it's left committee. It does happen, but it really helps a lot to work with your local legislator on things like this. It really does.
Yeah.
So that people can say, I'm fighting for my constituents who are telling me, and they would go in and offer an amendment to a committee bill or to a bill that a committee has passed out, and then, advocate for it. And sometimes it works.
Sometimes it's much harder in the Senate.
It is harder in the Senate.
To get a substantive amendment passed on the floor.
It's harder in the Senate.
It hardly ever happens because there are only 30 of us, and if it's gone through 2 committees, that's 10 people. That's a third of us that have already dealt with the bill, and don't try and second guess us. I mean, if it's a technical amendment, that's okay, but substantive amendments hardly ever do that.
So it's the responsibility of your local legislator, if you're working directly with them, to go to the committee in which the bill is?
No.
So this is where I wonder, when you say work with your local legislator, to me sometimes that feels like a black hole because they're on another committee and there's so much pulling on them, and the chance that they meet in the State House Hallway and exchange information, oh, by the way, I have a constituent who's going to...
So what we do, when I say work with your local legislator, what we will do will be to say, okay, I hear your issue and here's where the bill is. Here's a path forward that you might see. We sometimes locally can help you as your legislator, or we can just give you the information you need and the people you need to speak to move things forward as well. So there's different avenues, but making that connection with your local legislator is always really important in everything.
But I don't know how it works in the House, but in the Senate, I would not go to another committee to testify.
Right.
I might pass on information, but I would tell you to get a hold of Ginny Lyons. I wouldn't,
Yeah, the only time we testify to each other's committees is when we have an amendment or, we've sponsored a piece of legislation that will go in and testify.
Yeah.
Yeah, but other than that, we don't do that either in the House or the Senate.
Thank you, that makes it...
Yeah, but you need to watch the calendars, and if there's a bill you're particularly interested in or an issue, watch the calendars because things change. Then they can change 4 times in one day. I mean, really, because people come in and add.
Which is why, if you have a connection with the local legislator around a bill, they can keep track of that.
Well, I'm not going to keep track of any bills for anybody. I'm sorry.
I agree with that.
I'm sorry to say that.
But if you come to me and say, where is this bill, I can tell you.
And so right now the bill
And the
is
status of the bill.
S54 in-house Ways and Means.
It's in Ways and Means.
And S146 is commercialization, tax and regulate.
I have no idea what-
S146 is the prevention.
Is the prevention bill separate from S?
So I think.
Yeah, they're completely different.
Separate.
Gotcha.
Yeah. And the prevention bill, you said is going to be signed tomorrow?
Tomorrow.
Okay.
Tomorrow, the prevention bill is being signed? And if we want to see that bill, we can go online.
Yep, just search S146 on the General
And
Assembly
it's being
website.
signed by?
The governor.
It'll become effective July 1st. Yeah. I think that's the,
Yep.
yeah.
And that establishes this coordinating,
Yes.
where we used to have VADAC, the Vermont Alcohol Drug Abuse Council, and now we're going to have a different board
Yes.
representing that.
Yep.
Any other questions or concerns or, and remember, we are usually available to come. Whenever you need us. Well, not whenever you need us. But we
We try to be available
we
when
do
we
try
can.
to. And remember, January 1st starts a new
Whole new crack at it.
new
You
year.
better take a good break between now and then.
There's no break.
There's
There's
no
no
break.
break. There's no break. No,
No, there isn't.
this is a lifestyle, I guess.
Jeanette, Emily, Kelly, and Laura.
Thank you very much.
Very much.
Thank you.
All of you